In this lecture, we will discuss coronary artery anatomy and dominance. Being familiar with the coronary arteries is important for being able to localize myocardial ischemia or infarction, determine the coronary artery involved, and potentially localize where within the artery the occlusion occurred. Oftentimes, we can only determine the ischemic or infarctive region in which the EKG will reveal ST elevations in the region's respective leads. Okay, let's look at the coronary arteries here. There are two main coronary arteries that arise from the aortic valve. There's the right coronary artery, the RCA, which originates from the right aspect of the aortic bulb, and then we have the left main coronary artery, the LMCA, which originates from the left anterior aspect of the aortic bulb. So then we have this LMCA that is short and it divides into two arteries that supply the anterior and left side of the heart. That is the left anterior descending coronary artery, or the LAD, and the left circumflex coronary artery. Okay, so let's look at our arteries here. So again, to orient yourself, this is our aorta here. Okay, now we have our right coronary artery coming off the right bulb there of the aorta, and then we have our left main coronary artery off this left side. Okay, and what we have going off is this left main coronary artery divides into the left circumflex over here, and then we have the left anterior descending artery. Okay, and then off this RCA we have a posterior descending artery that we'll talk about next. Now, you've probably heard of something called coronary artery dominance. That is left, right, or codominance. This has to do with the posterior descending artery, or the PDA, which supplies the inferior wall of the left ventricle and the posterior 1/3 of the interventricular septum. It is the PDA that determines coronary artery dominance. In other words, a right dominant system, which is the most common variation and present in about 85 to 90% of individuals, means that the PDA is supplied by the right coronary artery, whereas with the left dominant system, the PDA is supplied by the left circumflex coronary artery. And in a codominant system, both the right coronary artery and the left circumflex artery supply the PDA. Okay, so not too difficult, but let's take a look at it. So right dominance, or right dominant system, is when the PDA arises from our right coronary artery. So again, right coronary artery, notice how it runs along this right side of the heart, comes to the back, and then in this case gives off our posterior descending artery. In a left dominant system, what we would have is, again, our left circumflex, and imagine we have some vessels that come around the back side of it, and they would supply our posterior descending artery. Okay, so if it's coming from the left circumflex, our PDA arises from the left circumflex, we call that a left dominant system. And then in some cases, you can have it coming from the left circumflex as well as the right coronary. Okay, so if both are supplying it, we call that a codominant system. All right, so let's review what we discussed before we end here. So the coronary arteries, we have the right coronary artery and the left main coronary artery that are coming off the aorta. Okay, so here's our aorta, right coronary, left main coronary artery. Okay, the left main coronary artery gives rise to this left anterior descending artery that goes over the anterior portion of the heart, and our left circumflex over here that supplies the lateral, the left portion of the heart. In terms of coronary artery dominance, we said that right dominance is the most common. About 85% of individuals have this, in which the PDA arises from the right coronary artery. Okay, and that's the one that's depicted here. Okay, you see it coming from the right coronary artery and going in this case. Now in the left dominant system, we have it coming instead of the right coronary artery. Okay, not here, it's coming from the left circumflex, okay, supplying that PDA. And then in codominant, we have both the right coronary artery and the left circumflex coming together and giving rise to this PDA. Well, that's the end of this lecture. We discussed coronary artery anatomy and dominance. I hope you learned something.